Students, uh, good morning to everyone. Today we are going to see a small lecture, a video based lecture on one of the orthopedic regional condition, a clinical condition we are going to see. So far we have been seeing the fracture, different types of fractures and activities based on that. Just for a change, I have taken this topic, to go into the regional side. Okay, the topic is most one of the important condition which we see in the clinical setup. The name of the condition is popliteal cyst. Okay, cysts. The two type of cysts are there on the popliteal region. So we are going to see that. Okay, so coming to the popliteal region, where is it? It is back of the knee. Okay, back portion of the knee joint is called popliteal fossa. So there, the two types of cyst can occur. Okay, so first cyst we are going to see. The two cysts are there. The first one is semi-membranous cyst or semi-membranous bursitis. The condition is called like that because the cyst, when we say cyst, it is nothing but the inflammation of the bursa. Okay, now coming to the semi-membranous bursitis, it is located. The problem is commonly seen as a small swelling, a cystic swelling at the back of the knee, and if you see very particularly attentively, the cyst will be on the medial side because the semi-membranous tendon is located attached at the medial condyle of the tibia. Okay, so it can be seen on the medial side. Okay, now what is it actually? It is nothing but a sac of fluid, nothing but the bursa. There is a bursa located between the medial head of the gastrocnemius and the tendon of the semimembranous muscle at the back of the knee joint at the area of the insertion. You can see here it is the origination of the gastrocnemius, that is the medial head of the origination, and it is the insertion of the semimembranous muscle. It's a tendon there. Okay, it's between the origination part of the gastrocnemius at the insertion point of the semimembranous muscle. Semimembranous is one of the hamstring muscle. Okay, so between these two soft tissues there is a bursa located. Actually, the purpose of bursa is to reduce the friction when there is a movement of two soft tissues, or bursa can be presented also between bone and tendon, bone and origin point of the muscle, or between the soft tissues, between the ligaments, like that, between the tendons, like that. Okay, so here, because of frequent friction, frequent action, movements with pressure, what happens? The bursa undergoes some type of friction and irritation. Because of long-standing irritation, the bursa can be inflamed. So what happens? The sac is getting elongated at the surface of at the length of the muscle, semimembranous muscle. And what happens? Sometimes it also goes down to the head of the middle head of the gastrocnemius. So it becomes very enlarged and elongated. And there also you can see some type of warmth over there, and visible swelling can be seen, and it will be very painful to the patient, and the range of motion will be restricted at the knee joint. Okay, so it is purely a mechanical origination. Okay, so now this is the clinical features you can see, and what is the remedy for this? The remedy, coming to the treatment part, clinical treatment part, the most prescribed clinical advice or clinical management for this problem is to take rest, because resting from the activity which is causing more friction, more heat over there should be avoided first. So rest is the first one. So most often many of the patients are getting a good result with the rest itself. Okay, along with the rest, we can also give, as a physiotherapist, we can also include cryotherapy. Cryotherapy, we all know, For the soft tissues, it is one of the important as well as the first level of treatment. So cryotherapy can be a good choice here. Sometimes in cases where it is not responding to the rest or cryotherapy, or sometimes people might be given clinically pain reducing agents, the drugs like non-steroidal anti-inflammatory drugs can be given to them. So sometimes with these all these conservative methods, if it is not responding well, then they may be advised to go for aspiration of the fluid which is persistently stagnant inside the sac. That will be aspirated. Then they will be advised to take some conservative management. Even if it is not properly treated, properly responding well, then they will go for surgical excision of the sac. That is the final part of the management criteria for this problem. Okay, so this is what about the semi-membranous cyst. Okay, now we are going for the second one, the second type of cyst which is seen at the popliteal fossa. That is the very commonly referred as baker's cyst, because it is very commonly seen in the people who work in the baking area, bakery. So it is called as baker's cyst. Okay, it is also seen at the popliteal region. Okay, so but the swelling, the similar to the semimembranous cyst, this also will be seen on the back of the knee joint, but not towards the medial side. This will be at the center part of popliteal fossa, center of the knee joint. Sometimes it will be even down. It may be upper part of the calf region. The swelling will be seen. It will be severely painful and restricting the movement also. Okay, what is the reason for this? The reason is mostly it is the herniation of the synovial cavity of knee joint. Okay, why it happens? It is purely because of a secondary formation due to some long-standing knee effusion. When there's a new effusion, there will be definitely synovial cavity, synovial membrane, everything is distended and extended. So in that case, when it is long-standing, a small portion of the synovial cavity gets weakened, and that is getting more enlarged, and it bulges, and also sometimes it distends downwards. Okay, so this condition is called baker's cyst. So what causes the long-standing effusion here, knee joint? Most commonly, it is a chronic osteoarthritis or chronic rheumatoid arthritis. Because of these two important conditions, there might be a long-standing knee effusion. That is the responsible causative factor for this baker's cyst. Okay, so even the clinical features are exactly similar to what we have seen with the semi-membranous bursitis. Okay, but sometimes it will be even more, because the cyst is mostly comparatively a bit larger compared to the semi-membranous bursitis. Okay, coming to the management part. What is the management? Here also rest can be a good choice here. Rest as well as treatment to the primary problem, that is treatment to the osteoarthritis or the rheumatoid arthritis could be focused. So most of the patients are responding well for this. If it is not responding, then we can go for the pain relieving and inflammation reducing drugs like non-steroidal anti-inflammatory drugs, and then the patient can be given in physiotherapy, cryotherapy can be given, cryotherapy modalities can be advised. Apart from that, they can also be given some strengthening and range of motion exercises. Okay, if it is not responding to the conservative methods, then of course ultimately the patient will be advised to go for a surgical excision of the portion of the sac which is extended downwards or extended bulged outside will be excised out, and the problem will be treated like this. Okay, these are the two important cases which often present to the physiotherapy. For both these conditions, initially cryotherapy, from physiotherapy point of view, it is cryotherapy, and as the initial first degree of modality. Once the acute phase is overcome, then the patient can be best treated with ultrasound therapy. Ultrasound, as we all know, ultrasound therapy will give a better result for various soft tissue injuries. In the subacute and chronic situation, it can be given. And depending upon the range of motion and the pain level and strength around the joint, if there is a weakness around the muscles acting on the knee joint, so other physiotherapy modalities will be accordingly selected and given to the patient. This is what is about the popliteal cyst. Okay, I hope you can understand this two important clinical conditions well, and I will be posting a small activity pertaining to this lecture. Okay, so all of you please listen to this lecture many times and try to do the activity that I am going to give along with it. The activity is only for the students who are appearing for they have the subject the physiotherapy, ortho physiotherapy, PT ortho. Okay, so those who are having clinical ortho need not worry, they don't have any activity. Okay, they can just understand the whole concept. I might be asking some clinical related questions for them. Okay, so the questions will be different for clinical ortho as well as for the PT ortho. Okay, and those who are appearing both clinical ortho and PT ortho should be answering both. Okay, thank you very much. See you. Good morning.